Good afternoon and welcome everyone. Thank you to everyone who is joining us this afternoon for this community conversation about COVID-19 and the flu as we plan and prepare for vaccination. I am Jacqueline Walden. I am the Regional Vice President for Community Impact for the American Heart Association. I have been with the American Heart Association for 7 years. I'll be helping to guide the conversation today, and that includes some of the questions that you, our attendees, submitted ahead of time when you registered for today's event. So before we get started, we wanted to thank the sponsor of today's conversation, Post-Acute Medical. Thank you to Post-Acute Medical for their support of the American Heart Association's Capital Region Heart Walk campaign and our Community Conversations series. We also want you to enjoy your Zoom webinar experience. We will have live speakers and slides throughout this event today. Use the sliding bar between the two to adjust the size of each window. The chat, webcam, and audio features have been disabled for participants, but we will be addressing some of the questions that you submitted prior to the event. So it is my pleasure to be joined today by cardiologist Dr. Lawrence Senaway, who will be helping me to moderate today's discussion. In 2005, Dr. Senaway became the inaugural director of the newly formed Penn State Heart and Vascular Institute. In 2011, he became the inaugural director of Penn State NIH-funded Clinical and Translational Science Institute. Dr. Senaway currently serves as president of the American Heart Association's Capital Region Division Board of Directors. Dr. Senaway, thank you so much for being with us and for your leadership here at the American Heart Association, especially during this difficult time.
Thank you, Jackie. We also have 4 other distinguished panelists who will be speaking with us over the course of the next hour and sharing their expertise. Cindy Findley, the Deputy Secretary for Health Promotion and Disease Prevention at the Pennsylvania Department of Health. Cindy began her career in public health with the department in 2000. During her tenure, she served in several program areas, including public health preparedness, children with special health needs and immunizations. Now, as Deputy Secretary, Cindy oversees the Bureaus of Health Promotion and Disease Prevention, Family Health, Communicable Diseases, and WIC. David Saunders, Director of the Office of Health Equity at the Pennsylvania Department of Health. David serves as lead for the Pennsylvania Interagency Health Equity Team, consisting of staff from key state agencies with the goal of increasing health equity and implementing Public Health 3.0. In April, David took on the task of developing a collective response to COVID-19 that addresses the implications of the pandemic on vulnerable populations. James Reichenbach, Chief Mission Advancement and Community Programs Officer for the Lancaster Health Center. James joined the Lancaster Health Center in January of this year. He also serves as adjunct professor at Elizabethtown College, facilitating courses in human services delivery, case management, and human development. Prior to his current role, he served as program director for Keystone Human Services of Lancaster for 19 years. Dr. Sunil Patel, pediatric cardiologist at UPMC Pinnacle Heart and Vascular Institute. He is also the director for the Adult Congenital Heart Disease Program and leads the program for fetal echocardiogram. Dr. Patel is board certified in pediatrics, pediatric cardiology, and adult congenital heart disease. He has also been an active volunteer with the heart screening program with the Peyton Walker Foundation. Thank you all for being part of our conversation today. We're going to start today's conversation with Cindy Findley. Cindy, we're facing a critical time in our fight against COVID-19, as cases have surged in October and November. Just as we're heading into the flu season, the Thanksgiving holiday, which is just passed, and Christmas, we're seeing an explosion of new cases being reported every day throughout the United States. Just yesterday, we had 2,700 deaths reported in the US. Cindy, where do we stand in Pennsylvania and locally here in the Harrisburg area on cases, testing, and hospitalizations?
Well, thank you, Dr. Senaway. And yes, the Pennsylvania cases continue to rise. And each day we've seen thousands of cases rising. And as of today, we've had the highest increase with over 380,000 cases. So we're asking Pennsylvanians to continue to wear masks, wash your hands frequently, and download the Alert PA app on your phone.
What is the most important thing for the public to know right now about COVID-19 in Pennsylvania going into the holidays? Issues related to gatherings, travel, etc.
Yes, good question. And I think we need to keep in mind to limit travel as much as you can, to minimize those large gatherings because of the continued high spread of this disease. And as I mentioned, continue to wear your mask, do good hand washing, and continue to practice those basic things.
Thank you, Cindy. Just a question regarding the state's plan for distributing vaccine once it becomes available. Do you have any information you could share regarding that topic, Cindy?
Sure, and I do have information on that. I actually am leading the vaccine task force for the vaccine distribution for Pennsylvania. And the way Pennsylvania is we're divided into two areas. We have the Philadelphia County, which they have their own distribution program, and then Pennsylvania, we cover the remaining 66 counties. And we've been working very strong in balancing the anticipated vaccine as well as reaching the very diverse group in Pennsylvania, our rural and urban areas that we have to cover for the remaining 66 counties. So we will continue to work on those pieces. We've been working very strongly with the CDC and partnering on our plan, and Operation Warp Speed has been helping us to make decisions on how to do this. Currently, there are our plans are in place to adjust to the vaccine that will become available, and that will determine where the vaccine will go.
Thank you. What are the biggest hurdles the Department of Health has encountered while coming up with a distribution plan? And how are you working to address this problem? What are your biggest worries?
Well, we've not done this before, okay? And it's a national effort. It's a huge undertaking. Our vaccine program typically distributes 2 million doses a year. We're looking at 10 times that amount. So there are, obviously some concerns about how all the logistics will happen. What I am confident in is the fact that we've had our vaccine program in place for a number of years, and we have systems that working with the CDC, we have been partners with them that help us have confidence on how to move the vaccine from when we receive it to the sites that will need it. We are working with a ton of our community partners. We've had great outreach and people that want to help, and we've also been able to partner up with our hospital systems, our federally qualified health centers, our pharmacy partners, to all kind of pull together on how we're going to help get the vaccine into the communities.
That's great. And what should the public know about the vaccine that could help make a vaccination campaign more successful? Are there common concerns that you're hearing from the communities?
I think a big message is, although we expect to receive the vaccine and expect to receive it as early as December, that there'll be very limited supply initially. And so we need to focus on certain groups that are able to manage the vaccine as well as able to vaccinate the numbers that need to be vaccinated. So let me just explain that a little bit more. The vaccines that are available, there are two types that are most likely going to arrive. Pfizer vaccine, I'm sure everyone might have read about, and Moderna. Two vaccines that have similarities and differences. The similarities are they're both 2-dose series. They both require a vaccination storage pieces. The Pfizer product is a little bit more significant. It requires a significant storage, very ultra cold. The Moderna product is a regular temperature at the freezer level. The dose sizes are that are available for when they are distributed are quite different. The Pfizer product, the minimal amount of doses that will arrive at a site is 975 doses. That's compared to Moderna, which is 100 doses. So that creates challenges, logistic challenges. But the good thing is we've already partnered with our health systems in Pennsylvania. We have connected with those hospitals that are able to manage the cold chain and also manage the large doses of vaccines so that they're able to vaccinate the healthcare populations within their health systems initially as the minimal amount of vaccine arrives. And then as more vaccine arrives, the plan will be expanding and being very flexible. I always tell people our vaccine plan is a framework and it has to be able to move about. And we can pivot and change as depending on the type of vaccine we get, how much vaccine, and the populations that we need to reach.
Well, thank you. Are there side effects that people should understand up front in adults or children with regards to the vaccines?
So that will most likely, we'll hear more about that once they have the emergency use authorization. That will indicate those pieces and actually give a fact sheet about the vaccine so that providers that are administering it or anyone that wants to read about that will have that information at their hands so that they can see that.
Great. And one final question. I know that you mentioned the Pfizer is going to be in groups of 1,000 doses and the Moderna will be smaller, 100. Is there any thought of using the Moderna for the more rural areas of the state where storage and challenges of the size of the dose as well as the coldness of storage will be an issue?
Absolutely, absolutely. We are very happy to hear that we have choices with vaccine and that we can reach our very vast and different population in the 66 counties we cover. So the idea is the Pfizer product will go to our larger health systems, and as the Moderna product comes out, we'll be able to work with our other smaller rural hospitals and our federally qualified health systems and pharmacists to help distribute.
Thank you very much. David Saunders. David, on November 10th, the American Heart Association released a presidential advisory in their journal Circulation regarding structural racism as a fundamental driver of health disparities. In Pennsylvania, 21% of the people who have died from COVID-19 were Black, while Black people make up just 12% of the state's population. What do we need to do differently to address these inequities as the pandemic continues?
It's an interesting question. I'm glad you pointed out that white paper. Systemic racism, we need to recognize, has positioned African Americans in the state of Pennsylvania, as well as throughout the country, in a very susceptible position. those that have poor educational opportunities based on systemic racism, based on redlining and where they live, they don't have the same opportunities to work at home like many of us are doing as we speak. If you have poor educational opportunities, you tend to have, jobs that put you in a position where you're more susceptible. You have service level jobs. You're working at a grocery store. You may be working on the back end in healthcare settings. You may be working in, again, positions where you are in more close contact with folks. So based upon that, some of the things that we're hopeful of and we've been participating in and working hard on is around testing. We've done some faith-based testing in 2 counties in the state because we know it's so important to make sure that individuals know their status and can seek healthcare based upon that. Looking at engaging the community around the importance of some of the mitigation factors that we're all well aware of, wearing masks, social distancing, that type of thing. Lastly, as we get towards the vaccine that Cindy just mentioned, we're hopeful that based upon some of the numbers that we see and the disproportionate effect on African Americans, on Latinos and other ethnic groups, that those groups are able to get the vaccine based upon their susceptibility.
Thank you, David.
You're welcome.
What are the emerging needs for the communities of color during this COVID-19 pandemic now, heading into the winter months?
Yeah, I don't know that it's much different for people of color based, compared to the majority population. But I think it hits African Americans and others at a different level as it relates to employment and childcare and education for their children. In many cases, people of color are, having problems paying their rent, and we know that relief is about to come to an end. Social distancing, as I mentioned a little bit earlier, is not as widespread for African Americans and people of color. So you're in kind of close quarters, and I don't know if that's going to change anytime soon. And I would also say, mental health. We've seen, more folks that we've heard of the need is greater or has been greater during this time, again, for everyone, but it's hitting people of color at even a starker rate. So I think dealing with those mental health issues is also something to consider.
And how is the Office of Health Equity addressing the needs of the communities of color during this crisis, during this pandemic?
Well, as you mentioned a little bit earlier, we have a health equity response team, and that's made up of 12 different committees focused on various vulnerable communities. And one of those vulnerable communities happens to be racial and ethnic minorities. So that particular committee is an august group of individuals coming from a variety of different sectors. They're looking at, the issues around testing, around PPE, community engagement. So I think we're in a great position based upon their expertise. There's some community members on there as well to implement some of the recommendations that they have put in place, look at the evolving nature of the pandemic. Right now, we are pivoting that group's focus on what is the best way to educate and make aware of our people of color in the state the importance of the vaccine ahead of the vaccine coming out, dispelling myths that may be prevalent for people of color, so that when the vaccine is widely available, the uptake of that vaccine will be very high for people of color, especially based upon the fact that they are more susceptible,
And
based upon their living conditions and work and that type of thing.
I wonder in this critical task that you're leading, what other stakeholders and organizations are you working with to accomplish these important goals?
Organizations like the American Heart Association, the YMCA, the United Way, various academic institutions like Harrisburg University and Penn State, our colleagues at within state government. So many, I'm not going to say most, but many state agencies are connected to our health equity response team. Work from aging to Department of Human Services to education. So we have their involvement and their subject matter expertise, at our disposal. So I think we have many of the right folks at the table. The governor's office is linked into the work that we are doing. So it's an all hands on deck activity. So we're doing our best and to try and not to be exhausted from this process, and working together to make as much difference as we possibly can.
Well, thank you very much, and we're all appreciative of your efforts and your leadership.
Thank you.
James Reichenbach, we know our FQHCs serve our most vulnerable communities. How has COVID-19 impacted your ability to provide care to these communities?
Thank you for the question and the opportunity. I would say dramatically, has had a dramatic impact. We have seen a significant increase, as you can imagine, in patient visits, a significant increase in anxiety that our patients are presenting for a lot of different reasons. We have social needs that are rising dramatically. We have patient medical needs that are rising dramatically. And with the specific issues that COVID brings, we've had to downshift our dental, our work, which has a significant impact on many patients who need that work over the past year. So it's been a pretty dramatic impact. And when you factor in the use of telehealth, which is relatively new in the FQHC world, it has dramatically changed the face of how we provide care. Some things have been a positive that have come out of that, but others have really shown the cracks that we have in our system and how far we have to go, specifically the lack of technology that many of our patients have access to and the struggles with which they are able to engage in telehealth to really protect themselves from having to come into the office setting.
Could you tell us a little bit about Lancaster Health Center and what it's doing to engage patients in telehealth?
Sure. So we are using every means at our disposal, whether it be social media, whether it be word of mouth through our other partners. Again, we recognize that a lot of our patients may not have access to high-speed internet, may not have social media, and may not be able to receive information in that way. We've used telephonic means, basically similar to what Mr. Saunders said, an all hands on deck approach, all methods on deck approach to reach out. We've also engaged in a very robust grant writing and grant procurement campaign over the past year, specifically directed at getting as many resources to increase the technology in the hands of our patients as possible. We have very generous organizations here locally who have stepped up to the plate and have wanted to help and asked where the biggest need was. And in many cases, it was that need. So providing connections for people, providing training for people to be able to use it. and also things that you don't think about, like how do you do telehealth and then not have blood pressure cuffs at somebody's house? That's usually something they would do on site. What about taking people's pulse? Things that you don't necessarily think about, but telehealth has really created a new world. So all hands on deck, every method we possibly can to reach out to our patients and our community.
So you described some of the barriers with telehealth, namely the lack of broadband, the lack of access for patients, some of the difficulties with getting specific tests like blood pressure. Are there any other challenges that you've seen, and any things that may be working better with telehealth than you would have anticipated before this COVID crisis hit?
Sure. So I would say a huge challenge is transportation. At the FQHC level, many of the patients that we serve don't have access to consistent transportation. While we try to position our offices in a way that is accessible, you still have to think walking 6, 7, 8 blocks, while it might seem accessible on a macro level, certainly isn't accessible for many of our patients, particularly if you have a patient who's suffering from COVID-like symptoms and is dealing with respiratory issues. Having to even walk several blocks is a huge barrier. So telehealth, getting people into this site, telehealth has certainly helped with that, to be able to access that. So that has been one positive, which is we've really helped with the transportation issue. I would say another positive would be the fact that our clinicians have such a great rapport with many of their patients that we've seen an increase in conversations about social service needs that we hadn't necessarily seen when people have come into the office. There seems to be a bit more of a relaxed nature when there's telehealth being used, where we're having a little bit more conversations. I think meeting people where they are gives a sense of relaxation for individuals and has allowed us to drill down a little deeper in some of the more important social service needs that we can help provide or direct our patients. And so while we certainly would not have wanted to learn these lessons under these circumstances, I really do believe that from the FQHC level, we are going to take a lot. And we're tracking this data in real time, making sure that we're understanding that we are in an unprecedented circumstance, and we don't want to lose any of this data, whether it be real quantitative or anecdotal, so that we can apply it positively going forward.
And I was just wondering, how are the FQHCs preparing for the cold and flu season in the midst of this pandemic that we're facing?
Great question. We have taken it upon ourselves to host several flu vaccination events out in the community, again, trying to meet people where they are. Those events have been well attended. We've gone all across Lancaster City to do that. We're currently planning for next week to have our first drive-up flu vaccination event, partnering with the city of Lancaster to do that. Hopefully, we're going to increase by several-fold the amount of people who are more comfortable coming up in their vehicle. They don't have to leave their car to do it. It also protects our staff. And really, we're doing that for 2 reasons. One, the importance of getting people flu vaccinations, particularly this season, to keep them out of the emergency room with so much COVID community spread. But we're also tracking data and learning, because once the COVID vaccination rolls out, we're going to need to know how to do it, and need to know how to do it quickly. So we're taking all the lessons we're learning from the flu vaccination events and keeping that institutional knowledge to apply it once the COVID vaccinations come out.
Well, thank you very much for those excellent responses to the amazing challenges the FQHCs are facing.
My pleasure.
Dr. Patel, thank you for joining us today. While the overwhelming majority of COVID-19 cases are among older adults, we know that children are a growing percentage of COVID cases. Nearly 3% are ages 5 to 12, and nearly 6% are ages 13 to 18. Dr. Patel, what do we need to know about the impact of COVID-19 on children? I think you might be on mute, Dr. Patel.
Can you hear me?
Yes, we can now.
Thank you, Larry. It's always a pleasure to speak at American Heart Association. So from COVID-19 pandemic, there is a significant impact on children's health, both that I've seen from physical standpoint, as well as I would say from mental health standpoint. As we all know that the virus is highly infectious, and children do get infection, and especially we've been seeing a lot of rise in kids with infection. Almost 1 million children reported to have infection last month. So it's a significant number. The good part about the children's health from COVID-19 is that the majority of them have only mild illness, and almost most of them have excellent recovery. What we don't know, because this infection is so new, is that the long-term impact. But typically, kids' illness resolves in less than 5 days. However, some kids do develop severe illness and requires hospitalizations. I want to emphasize that it is rare, but children do develop an intense immune response from COVID-19, and very minority of them, that we all of them heard on the news, that they develop, we call multi-system inflammatory syndrome, which is very similar to children with Kawasaki disease and have effect on the heart. And even with this particular syndrome, children do well. They are very, very ill, and they are in the ICU setting, and it has intense multi-organ involvement. And the majority of the children appear sick at home to start. They have abnormal blood test. Pediatricians usually recognize these things, or the emergency room picks up this condition very well, and the kids get admitted. But children's, even in the ICU setting, most of the kids recover very, very well. The deaths among the children from COVID-19 is extremely unusual. So this is a very positive news, at least how the kids handle this particular illness and the immune response. One thing I do say, that the kids do spread virus among the family and the other family members, and most importantly to the older individuals in the family who may be more vulnerable for severe infections and complications. One thing that I have also noticed, that they have a lot of psychological impact, especially, things going around with them, social distancing, school closures. They have to be distant learning on their iPads and laptop. Lots of families are already experiencing the psychological burden. And I can see that as I see patients with COVID-19 and the kids. A lot of families do tell us that how things go at home, and how much stressful everything is. All the school closure, lack of outdoor activity, abnormal diet, their sleeping habit change. This changes a child's usual lifestyle, and overall it causes more distress. They become impatient. Their behavior change. They're difficult to manage, and this problem, especially it's even more challenging when two parents are working, or if it is a single parent and one of their kid or one of the family member develops a COVID infection. And as I can tell you from my own experience as a frontline worker, it is challenging, how we talk to our kids, how we talk to our family members, and how, in fact, some of our relatives perceive me for possibly thinking I could be a source for COVID infection. But I think now people have realized much more. So I think it does have a lot of impact that I see among the children.
And we were wondering, or I was wondering, or submitted question states, what should people know about COVID-19 for children and the vaccine? Are there any specific known side effects or concerns regarding the vaccine, or concerns about the distribution plans?
Well, right now, regarding the data on safety and efficacy of vaccine among children particularly, it's not available yet. There are 3 companies that we see in the news that there is sort of a race among, they are coming out with excellent results on the vaccine. They have a very high percentage of a success rate. Most recently that I read, that the Pfizer company has started enrolling patients up to the age of 12. So anywhere from 12 to 17, they're enrolling patients already for the vaccine trials. So I'm sure that, they will come out with good results. And I have a lot of confidence in our researchers, in our vaccine team. We have historically done a good job. And of course, NIH and the vaccine efficacy is always tested before it becomes available to the public and vaccine. So
I was just curious, Dr. Patel, In what ways do you see the pandemic affecting patient care and outcomes?
For children?
Yes.
Yes, it does have a lot of impact. How we see children's being tested.
So we're having a little bit of a connection challenge with Dr. Patel right at the moment. Um, um, and what I might suggest, if it's okay, would be um, Dr. Patel, can you hear me now?
Yes, I can hear you.
Okay. So we just stated that it is having some effect on patient care and outcomes. And I wanted to close with a question about the American Heart Association has responded to the decline in heart attack and stroke emergency calls by creating a new nationwide public awareness campaign called Don't Die of Doubt. The campaign urges individuals to call 911 at the first sign of a health emergency. What do you want patients to know about seeking medical care right now?
I think it is very important. This is a very important question because of a lot of belief that the patients have that it is not so safe to go outside. I think they need to realize that if they have a stroke or a cardiac emergency or a heart attack, don't delay the care because things can be valuable if they are done in time. It could be life-saving, and definitely for strokes and heart attack, I think the service and the care in time is most important, and these things are done and managed well in the hospital setting. So I think people don't need to be afraid. I think they just need to seek the care when they are not feeling well and not sort of hibernate or hide their symptoms. I think it's very, very important.
Well, thank you.
Well, thank you all to our panelists today. And before we let you get away, Dr. Senaway, we want to have a few moments just to ask you some questions. So thank you for leading the discussion. And we know that you're a cardiologist, and preventing and improving outcomes for patients in cardiovascular disease is certainly more important now than ever before. So we've all heard that older adults and those with underlying health conditions like heart disease are at a greater risk for serious illness from COVID-19. So can you tell us a little bit more about who's at risk and why?
Well, as you mentioned, Jackie, elderly individuals are more at risk. And individuals who have underlying risk factors for cardiac disease and atherosclerosis seem particularly predisposed, along with individuals who have asthma and diabetes. And also individuals who suffer from having challenges to seeking health care and suffer from food insecurity and other social determinants of health. It seems that COVID-19 just accelerates the challenges we as a society have with diseases within communities of color, as was mentioned earlier, and in individuals who have challenges in obtaining care, dependent on where they live. One of the areas in particular might be rural communities and those who live in areas where access to care is a challenge. So I would say that those are some of the areas of, or the people who are most at risk. Why? I think because number one, it just brings out the differences in longevity and outcomes individuals face when they have when there's intrinsic racism in the system, and infrastructure is not as strong in some areas as it is in others. I think that's one reason. I think another reason that needs to be evaluated is if there are specific metabolic issues that might COVID disease worse, that might contribute to the disease being more serious in certain populations. For example, the angiotensin 1 through 7 endocrine factor is thought to be a dilator and to prevent inflammation and to prevent clotting. And we know that in certain populations of patients, the concentration of this hormone is decreased. So certainly there needs to be more work on the pathophysiology seen in this disease.
Thank you for that. And you really outlined some really serious and challenging issues that folks face, which this next question I have has a little bit to do with that in terms of how people can keep themselves safe until they receive the vaccine that Cindy was talking about, or other measures become more available to them.
Yeah, so I think the one point I would make is that wearing a face mask matters. It is not a political statement. Wearing a face mask is absolutely vital for people who are outside or decide to go into an area where they're sharing air with other people. They're indoors. Keeping that mask on is perhaps the most important thing we can do. Maintaining social distance, keeping away that 6 feet away from individuals has been shown time and again to be a critical issue. And following that and wearing the mask are absolutely critical. Another issue is washing your hands. It's thought that people, when they get the virus on their hands and they touch their face, that can be a way of getting the virus into mucous membranes and potentially contracting it. So hand hygiene and washing your hands is really critical. I think some of the other subtle things that are really important is when people are in groups, if they have to be in groups, loud talking is really a problem, and laughing and singing. There have been a number of cases that have been reported by the CDC where outbreaks occurred in groups that were singing together. So these all turn out to be really important issues to prevent the spread of this disease.
Wow, thank you so much for that, Dr. Senaway. And I was thinking as you were talking too, we've been getting this information since early March, right? Wash your hands, wear a mask. And I really appreciate you sharing that again, because sometimes I think we forget those are the preventative things that we can do. So thank you for laying that out so perfectly for us. So before we go, I wanted to invite all of our panelists to come back on camera for a few minutes. So please come back on camera, just hit that little icon that says start video. And we want to give everybody an opportunity to share one final message with our audience today as a takeaway from today's conversation. So I'm going to start with you, Cindy. What would be your takeaway message to our audience today?
Well, I just would say that everybody be safe and calm and understand that we're all working through this together, and we will all get through this together.
Thank you very much. Very important too. Thank you. David, what would be your takeaway to our audience today?
Since I'm the health equity dude, I would just ask that those that are on the call think about those that and act upon those that need the most help, the most vulnerable in the state of Pennsylvania. Please don't forget those folks, and understand that they're not in the position in some cases to help themselves, and they have to work in certain industries, and whatever we can do to support their efforts, I would encourage us to do so.
Thank you so much for that, James. I'm sorry, David, thank you for that. And I was looking at you, James, so could you share with us maybe, you know, and don't feel like you guys are allotted 2 minutes, so feel free to use all that up if you'd like. So what would be your takeaway? Of course.
Just kidding. No, I would just encourage everyone on this call to really, you know, be willing to share some grace and some love with each other, and also for the people that are working in the healthcare realm. You know, you see the signs, you know, healthcare workers are heroes, healthcare heroes work here. You know, it might sound like a neat slogan, but I'll tell you something, I've gotten a crash course over the last year of what it really looks like on the front lines of a healthcare pandemic, the likes of which we haven't seen in our lifetime. And it is brutal at times. It's defeating at moments, but there are also signs of victory and support and rallying around, the likes of which I've never seen in any other field. So I would just ask everyone on this call, you know, if you have friends or family members who are in the healthcare field, they may not talk about it a lot, but the reality is they are going through it right now. It is a really, really tough time and a really tough circumstance. So just show a little grace, and also show some grace to one another. This is an unprecedented situation, and it's okay to be stressed out. It's okay to feel bad. It's okay to wonder what's coming next. You know, I'd like to say give hugs. We can't do that. I'd like to say pat on the back. We shouldn't do that. But just show a little grace, show a little compassion for one another, and just help each other get through it. I agree with it. We're going to get through it and come out the other side. But in the meantime, a little love, a little grace, a little patience with each other will go a tremendously long way to get us to where we have to go, which are, I believe, brighter times in 2021.
Awesome. Thank you, James. Somebody on here really needed to hear that, and that I need to hear it, and I'm not on the front line. So thank you for that. And so I'd like to go to now Dr. Patel. What would be your takeaway to our audience?
Well, you know, I would like to emphasize that this particular virus is very infectious, and from children's health that I have emphasized previously, that children do get infection, but most of the children do very well from this infections. You know, very, very small number of patients develop a severe infection that actually needs to be hospitalized. So parents do take your kids to the provider if they're not looking well. Don't just think that this is another virus and they're gonna get over. Another thing that the kids do spread virus to the other family members, especially the older ones that I'm more concerned. So teach kids about hand washing, wearing masks, you know, teach them that not to go on a play if they don't have to, if they can avoid something, non-essential contacts. I think those are the important thing. Hopefully, you know, we all work together now, and with the vaccine around the corner, we should be able to mitigate this pandemic, you know, for next few months or at least another year. I think that we'll be practicing proper hand washing, face mask, and being vigilant about avoiding contacts whenever possible, you know, looking out for sick people, and not having non-essential gathering. And so I think those are the points I would like to emphasize.
Thank you, Dr. Patel. And Dr. Senaway, you gave us such a great reminder of what we all need to be doing. What would be your takeaway for our audience?
Yeah, I would say I think the key message has to be hope. The idea that the cavalry is on their way. We have vaccines. We have professionals at the state level who understand how to distribute these vaccines. And within a number of months, we will have injections that people will take that are safe, that will protect them 95% of the time, which is extraordinary. Until that period of time when they get their vaccine, it's important to do the things that we've heard on the news. Wear your mask, social distance, wash your hands, and Finally, if you're not feeling well and you're ill, one of the safest places you can be to try to get that problem taken care of is at your doctor's office or in a hospital. Don't try to self-treat yourself and wait till the pandemic's over. Many diseases are made a little bit worse by this pandemic. So be proactive if you're not feeling well and get it taken care of by going to your physician or hospital. We're all in this together, and as many have said, there's hope and we'll come out the other side of this.
Excellent. Cindy Findlay, James Reichenbach, David Saunders, Dr. Patel, Dr. Senaway, thank you all so much. This has been such a valuable and amazing conversation, and we thank you all for being available and participating with this today. So I just want to wrap us up by sharing that, with everyone, if you want to learn more about American Heart Association's resources related to COVID-19, you can visit heart.org. You can also get the latest statistics and information on COVID-19 in Pennsylvania on the Pennsylvania Department of Health website. That's at health.pa.gov. We also encourage you to follow us on social media for daily updates on health news, resources, and events across Pennsylvania. You can also find us on Facebook, Twitter, and Instagram at AHA Pennsylvania. And lastly, thank you all again for joining us in our conversation this afternoon. Our attendees can expect a follow-up email with links to some of the resources that we talked about with you all today. And if you have any questions, please reach out to Jen Yesavage at jen.yesavage@heart.org. And if you don't know how to spell that, that's JEN.YESAVAGE@heart.org. Thank you all and have a wonderful rest of your day.